Effects of teen drug abuse, a case for drug testing in schools. Teen drug use has long been a concern for both parents and school administrators alike. Recent studies have shown that the usual drugs are still around, while new drugs are making a debut with teenagers. The landscape of drug use among students is changing, with new trends emerging. Illicit drug use remains high among students in grades 8 through 12, both in terms of the total percentage of students using drugs and also in the frequency of use. On the positive side, the use of inhalants is down, which is likely due to stricter regulations on purchasing items like canned air. Ecstasy and cocaine use are also dropping off significantly, and most surprisingly, alcohol consumption is at an all-time low among students. However, the main drug of choice among teenagers is marijuana. With the recent legalization of marijuana in certain states for medicinal purposes, marijuana is being viewed as less dangerous than ever before in the public eye, which is likely contributing to its continued rise in popularity. In fact, recent figures show that more teens smoke marijuana than cigarettes now. Recently, synthetic marijuana like Spice and K2 have also become popular. These synthetics have come onto the drug scene in a big way, with approximately 10% of students in grades 8 through 12 reporting using them in the past year. The use of prescription medications remains substantial as well, the most common of which are Adderall and Vicodin. Sources for these drugs include friends and family members who have had the drugs prescribed for medical conditions. Oftentimes they are stolen from household medicine cabinets. With the high rate of teenagers experimenting with and becoming addicted to drugs, many people have made the case for random drug testing in schools. But current legislation is always a concern when discussing controversial issues like drug testing in schools. So what does the law say about drug testing in school? The justification behind drug testing in schools for athletes and students participating in extracurricular activities is acceptable because it's very easy to see what teenage drug abuse can cost a school. Those students are representing the school publicly, so drug use can cause them to reflect poorly on the school and open the school up to liability. The debate begins when discussing the issue of testing the rest of the student body. Students and parents alike sometimes argue that drug testing is an invasion of privacy. However, U.S. Supreme Court rulings have declared that drug testing at public junior high and high schools does not violate students' Fourth Amendment rights and is legal in the following cases. Student athletes can be subjected to mandatory drug tests without any suspicion of drug use. Students participating in school-sponsored extracurricular activities can be randomly drug tested without any suspicion of drug use. Any student has to submit to drug testing if the school has a reasonable suspicion of drug use. Regardless of what rights schools have when it comes to drug testing students, parents still have ultimate authority. If parents want to prevent teens from experimenting with drugs, the best way is simply to sit down with them and have a conversation. Teens whose parents talk to them about drugs are less likely to try them. Before your teen finds him or herself in a situation where they are presented with drugs, have the talk with them and encourage them to make the right decisions.